Hi everyone, this is Dr. Ginger here. I have been asked a lot to demonstrate sleeping solutions. This could be for prenatal, it could be postpartum, it can be hypermobility, so a hypermobility issue, Ehlers Danlos, or just simply hypermobility kind of syndromes or tissue issues. It could also be after you're recovering from hip arthroscopy. Or what if you're postpartum hip arthroscopy or labral tear and hypermobility like hip dysplasia? That is not an uncommon scenario, especially in women's pelvic health. So here's a little bit of what I have learned over the years, actually going through all of these things myself as a mom of three, et cetera, et cetera. You might need a bolster or a really firm pillow. Even a sofa cushion or something that's really stiff and doesn't give a lot will work the best. I have just 2 hospital pillows here and a yoga bolster. You can make anything work, even stacked Mexican blankets. Okay? So when you are trying to get comfortable sleeping, if you have hypermobility, again, recovering from hip scope, prenatal, or postpartum, then you may not be able to rest flat on your back or really on your side, because straight on your side can actually hurt sometimes. So you're going to do what I call a quarter side lying, kind of a half of a side lying position. To do that, you're not going to put weight directly onto the hip or the shoulder. I'm going to show you 2 different versions of this kind of quarter side lying or half side lying position. The first is pillow under the head. You're going to have an arm straight out, so you need lots of space for this, right? Your partner may need to go sleep in another room for a while. You're going to take a yoga bolster and put it behind you. This would be straight on your side. Doesn't work a lot of the times. In pregnancy too, you can have a lot of swelling from increased blood volume. So you're going to tuck this pillow in behind you and you're going to lay backwards on it to where you can stretch out your leg over the top of the bolster. See it here? Over the top of the bolster in a way that supports the shoulder, it supports the hip, allows you to kind of stretch here, but no pressure. Excuse me, I think I hit my mic. No pressure on the shoulder, no pressure on the bottom hip. So that's a position that you can be in for side lying, or you can take the bolster around to the front side. The bolster then allows the leg to go over. Now, this is pure side lying, right? And side lying, if you don't have any bony hot spots or hypermobility, this may work fine. For a lot of people, it doesn't. So you have to take this bottom leg, straighten it out, and roll almost over towards your stomach. Okay. When you do that, you're going to tuck this in, support the belly, right? Support the leg. You're actually kicking your bottom hip out backwards to the wall. Now, for some people, this causes a little pinch in the shoulder. In that case, you could bring the arm around behind you and sleep like this. Still has room for the belly. Hip is in neutral, spine is in neutral, and the arm rests here. Okay. If you don't have a pinching shoulder, then you could bring another pillow in, stretch the arm out again, and pull this arm in. That allows you to kick the bottom hip backwards. So if I pull this bolster away, this is what it looks like. I'm actually rolling towards the floor to get a comfortable position. Okay, I hope that wasn't too loud with my mic here, but those are 2 different ways that you can take pressure off all the hot spots while also keeping your spine, your hip, and your shoulder in a neutral position.